Hello.
Hello, my name is Terry Collins, and a few years ago I underwent a torn meniscus repair. Meniscus is a cartilage that helps to complete the integrity of the knee joint when it undergoes any kind of stress or tension.
Okay, so what happened to your meniscus?
Well, the meniscus was torn, was leaving kind of rough, jagged edges inside which were rubbing against the bone and causing me pretty severe pain.
How did this happen?
Over the years, I've been quite active, growing up, cheerleading and all that. But I work in a kennel now. I own a kennel. And over the years, where I do doggy daycare and so on, I interact a lot with the dogs. And I've had a lot of incidents of dogs running into my knee and pushing it backwards the way it's not supposed to bend. And over time, it's kind of worn it down, and I set myself up for a tear.
What exactly happened when you tore it?
I actually was working out, and I was doing kind of bench presses with my feet of some pretty heavy weights, and I felt it go, and it got worse.
So how did you fix your torn meniscus?
Well, I had to have it surgically repaired. I did try to do physical therapy and cortisone injections in hopes that I could avoid doing the surgery route, but it wasn't enough, and I did need to go in and have it done orthoscopically.
Orthoscopically means?
They make a small incision, and they actually do the surgery through very, very small means with like a microscope that goes right into the joint so that they can see what they're doing, but they don't have to open up the entire knee joint like what they used to have to do.
Ew.
Yeah.
Do you have a scar?
Very, very little. They made like 3 little holes, and there's really nothing much to look at anymore, which is nice.
Didn't you tear your other meniscus as well?
I did. A lot of times once you tear one, and then the stress gets put on the other knee because you're compensating for the one that hurts. And I did actually go right up until the point where I had scheduled surgery, but I was able to cancel the surgery about a week before I was due to go in. The reason I could cancel it is because I started going to a chiropractor who adjusted me and got my body in a more proper position. That plus the fact that the one that I had already had done was getting better and was causing less compensation from the other knee. And the time of the year, I was doing a lot less activity at that time. So just overall, I think all those things allowed me to get away with not having it surgically repaired.
So what are the complications of having a torn meniscus?
Well, the tear itself is very painful, and everyday activity. I mean, when you sit and you're resting, you put ice on it, that helps a lot. But when you get back up, it's stiff, it's sore, it's hard to move. Any twisting, turning motion really aggravates it. As far as when the surgery was done, it was pretty fast recovery for me. I was actually out doing agility a couple of weeks after I had the surgery done, which I probably shouldn't have done, but it really made a big difference.
So I understand that they did something special to your knee during the surgery to make sure that they didn't operate on the wrong leg.
Yes, they did. They actually took a pen and they wrote all over my knee, and they said, "This one." And everywhere, left, had arrows, they had all kinds of neat things. And they did this all on the knee so that when I was under anesthesia, they wouldn't accidentally operate on the wrong knee.
That would be bad.
It would be really bad.
Did you have to have a brace on it for a while after? Did you have a cast?
I never had a cast, but yes, I did have a brace. This brace was the one I started out with. It's pretty heavy duty. It actually has metal rods in the side. It has some joint with it, but it doesn't allow the knee to bend backwards. So like I would wear
So
it.
if a dog ran into you.
Right. It wouldn't allow the knee to go any more than straight.
Wow. That's actually kind of cool.
Yeah, it's pretty cumbersome in the summertime though.
So it's been a while after you've had the surgery, and does it ever really go away?
I wouldn't say it totally goes away, but there's some arthritis to be had with all of the, injury. They do say that eventually the meniscus can wear out, especially in a circumstance where it's already been operated on. Pieces of it have been cut away to get rid of the jagged edges. Eventually I may end up with a bone-on-bone kind of situation that will be requiring a knee replacement surgery. But at this time, I'm able to control it. Sometimes I'll take, a pain reliever if it gets bad. But if I don't overwork it, I'm doing pretty good.
That's good. So did you have to change your lifestyle at all because of the injury?
I did somewhat, but pretty much temporarily. I had to obviously take some time off from the kennel, and I had to keep my leg elevated, ice it on the short term. I find now that I do fine everyday life. I can work at the kennel. Everything, goes well. I still get dogs running into my leg once in a while that make it hurt, but I can still do agility as long as I don't do too much. I do pretty well, which is good because the doctor did tell me that I might have to think about giving it up, and I said, no way.
Thank you.
You're welcome.
Goodbye.
Bye.